gents, my name's Chris. I'm one of the physiotherapists at the Police Rehabilitation Centre. Today we're going to do a hand strength video. If you've had a recent injury or you've had recent surgery, please discuss any of these exercises with one of your local physiotherapists or GP prior to doing these exercises. In addition, if you've got any pain when you're doing any of these exercises, please stop that exercise immediately. Okay, so the first exercise we're going to do, we're not going to need anything for this, we're just going to do some 3 basic exercises on the table without doing anything. The first exercise we're going to do is keep your hand flat on the table. We're going to keep the fingers together, thumb stays where it is. We're going to roll them knuckles up to the ceiling and come back down. The idea is you keep your forearm and your hand down. I'm going to show you it side on as well. Yeah, we're going to strengthen the small intrinsic muscles into your hand, the lumbar muscles. Work from there. Okay, so you could do 10, 15, 20 of these exercises to start with, just building up a little bit of resistance in there. It shouldn't be hard, it should be nice and easy. Next exercise is just to try and splay out and in. So you're going to keep your hand flat, splay out and in. And a way you can increase this resistance later is you can put an elastic band around your fingers, around there, and then you can work across. The last exercise is we're going to use a mobile phone or a key fob or anything like that, anything flat. We're going to put our elbows on the table, keep our wrists straight. We're going to bend our knuckles to 90 degrees. We're going to pinch that foam, grip it, and going to try and pull the hands apart. Okay, so providing a resistance. You may feel it in the intrinsics of your hand, yeah, and it's going to increase your grip strength and help to straighten fingers if that's the issue that you need to do. Going on to some equipment. Now, some of this you can buy online. Theraputty. This is a yellow Theraputty here. There's lots of different resistance levels. I would start light, yellow or pink, and they come in lots of different shapes and sizes. This is quite a large bucket because we have it here at Flint House. And the idea is what we would do is don't go too heavy on this to start with. You would roll it out into a sausage shape. Use both hands, yeah, and working across ways, yeah. And we're trying to get our fingers working on there and our hands, just trying to strengthen it up. Next exercise, we're going to work along. So every time, we're going to pinch a different finger with our thumb every time. Now bear in mind that your ring finger and your little finger haven't got very good, strong pinch grip. Okay, so that's natural. You can try it on your good hand as well to show as an example. And you're just going to work across ways, pinching it each individual time. You can do that 2 or 3 times, it's very easy to do. Let the putty go with the resistance, yeah? So don't just go with the resistance of the putty, don't force it, you don't expect it to give immediately on some of the heavier levels, but you don't have to work hard during these exercises. Your hand muscles aren't great at endurance, so don't expect them to work fast and for prolonged periods of time. The next exercise, we can just roll it into a ball. You can just start to manipulate that by just giving a different pull, different directions, different fingers every time. There's lots of different ways you can use this putty. So try and think of problems that you're having with your hands and see whether you can work this in different directions. You can do lots of grip twists, using a doorknob, try and grip from there. You can do pinch grip. Yeah, there's lots of different ways. Tripod grip with your 2 fingers and thumb. But there's lots of different ways you can use the putty to try and create a resistance. You can spend 5 minutes doing anything in any directions with that. The other way we can do it, we can put our fingers in and we can splay that hand outwards. So we're working on the extensors on the back of the forearm and hand. And likewise we can go on to the flexors going inwards. So it's quite nice and easy. It's good resistance. As I say, you don't have to spend long in it. Other examples of different things that you may see are the digiflexors, so they come in different colours and different resistances. Don't go too heavy, we don't have to. And we can work different separately, we can do different fingers every time, we can do as a group. We don't want to be sat there all night doing loads of exercises just in front of the television, squeeze, because that doesn't do everything that our hand needs. So don't expect it to provide everything, but you can do lots of different work with these. But as I say, they are available. Torsion bars are other alternatives, so these come in lots of different colours and things, and what you can do is keep your elbows on the table, work backwards, work towards you, forwards, up and down. So we've got lots of different ways that we can work that. Gives you great cylindrical grip, and you can work on that too. We can start to look at different ways. I mean, the common stress ball is something that a commonly sick patient's being given. Do that, but don't do it all day and all night. We don't have to work them muscles in that way. It's only a small percentage of how we use our hand. We can do lots of different exercises in this area. We can use a small weight, a bottle of water would be an example. We can work in different areas where we can get the forearm working with our supinators and our pronators, very important part of that. And then we can work on our extensors, which are down the back of the forearm, and then we can work on our flexors. So there's lots of different exercises in that area. Another exercise that is coming forward is a very good one is dart throws motion. So away today into extension, all the way through into flexion. So it's a bit like throwing a dart. And what this is doing is it's getting all the muscles, the extensors and the flexors all working together eccentrically and concentrically. You can do that 10-20 times, but try and keep a nice smooth movement all the way through into flexion and on the deviation and extension into radial deviation. So we're trying to work on a good, stable wrist in that direction. There's lots of things that you can use at home. Yeah, we don't necessarily have to go and buy things. Pack of cards we can use to improve dexterity, and dexterity is one thing that often gets neglected. We could shuffle, we could pick up cards, we can do lots of different things with cards that at the end of the day take for granted, but try and get your hands working with lots of different examples. Yeah, we've got jar opener, something that is common with hand injuries we don't have, but also just a few little household ingredients. Lentils, we can pick up different finger every time with your thumb, get working, and this will increase your endurance and your dexterity. It's something that we often take for granted, but when I start working with patients with hand injuries, they'll be surprised of how poor their dexterity is to start with, but also how poor their endurance is. But there's lots of different things that in your household, in your cupboards, that you could use, from screws and bolts and things like that, all the way through to household lentils. We've got little tubes, little straws, we've got acupuncture sheets here, and we have a Flint house that we can work on trying to get a bigger grip around, and likewise we can work on different fingers every time, trying to get a little bit of grip, try and get all of them fingers working in different ways. And you could be inventive, you can have a look at what's in your house and work from there. And the last thing is just some pegs, so we can just get working on a little bit of pinch grip, something very easy just to find in your house. And there's lots of different ways you can find things, but just try and think outside the box if you haven't got any equipment before you go and buy it, but you can start to get working in lots of different ways. Have a little go at these, see what you think, give us a shout, give us any questions on our YouTube channel, and any issues, just see what you can do. Thanks a lot.